Have you ever noticed your gums looking a little puffy in the mirror?
Oh, yeah.
Well, we're diving deep today into something called gingival enlargement,
Okay.
and it can really impact your daily life.
It can, absolutely.
Like we were looking over the research, and it can affect how you eat and even your self-confidence.
Yeah, it affects everything, speaking. And yeah, just your self-confidence for sure.
So to really understand gingival enlargement, we've got to unpack some of these crazy terms.
Yeah.
Like what is a gingivectomy?
Oh, yeah.
And what is a flap operation?
A flap operation,
Scaling and root planing.
scaling, and root planing.
Yeah,
These sound intense.
they do sound very intense, but they're really not that bad.
Yeah.
Think of your house. You can give it a light sweep or you can really deep clean it.
Right.
And so scaling and root planing is basically just a deep cleaning for your gums.
Oh, okay. So that makes sense.
Yeah.
So if scaling and root planing is the deep clean,
Uh-huh.
when do you actually jump to the gingivectomy and flap operation? Right. So there are a lot of different types of gingival enlargement. So we categorize them into things like chronic inflammatory gingival enlargement,
Okay.
drug-induced enlargement,
Gotcha.
and things like that. And so it really just depends on what's causing that enlargement.
That makes sense.
If you think about your gums like a sculpture made of clay,
Okay.
sometimes you need to remove a little bit of that clay to get back to that perfect shape.
Okay.
And that's kind of what a gingivectomy is doing.
So it's more of a shaping.
It is,
Oh.
yeah,
Gotcha.
to get that natural contour back.
What about a flap operation then?
So a flat operation, we actually lift up the gum tissue,
Oh, wow.
kind of like a window,
Okay.
and we can go in there and we can clean.
Yeah.
And sometimes even reshape the bone,
Wow.
and then we close that window back up.
That sounds intense.
It can be, yeah.
So is gingivectomy and flap operation like the worst case scenario?
No,
Uh.
not always. It really just depends. Sometimes it is the best treatment. Sometimes people are really apprehensive about having surgery on their gums,
Yeah, I bet.
but I will say that it is extremely effective.
Okay.
And a lot of times there's really no other option.
So it sounds like gingivectomy and the flap operation are a lot more common than we might think.
They are.
So you mentioned a few of the different types of gingival enlargement.
Uh-huh.
Can you break those down for us a little bit more?
Yeah. So chronic inflammatory enlargement is usually caused by plaque and tartar buildup.
Okay.
And drug-induced enlargement, as you can probably guess, is induced by medications.
Okay.
And there are a few other types, but those are the most common ones.
So when a dentist is looking at a patient
Mm-hmm.
and diagnosing them,
Right.
what are some of the things they're looking at to determine what type it is and what treatment to use?
So we take a full medical history.
Okay.
We want to know about any medications that they're taking,
Okay.
any underlying health conditions.
Gotcha.
And then we do a clinical exam. So we're looking at the gums. We're looking for any redness or swelling,
Yeah.
bleeding.
Gotcha.
And we also take x-rays to
Right.
look at the bone levels.
So kind of like a holistic view
Exactly.
to determine the best treatment.
Right.
It sounds like it's more than just poor hygiene.
It is. A lot of people think that gingival enlargement is just caused by not brushing and flossing,
Yeah.
but there's a lot of other factors that can contribute.
Interesting. So we've got this case example about a 16-year-old who had gingival enlargement caused by a medication called cyclosporine.
Right.
So what happened there?
So this patient was taking cyclosporine for a medical condition.
Okay.
And unfortunately, one of the side effects of that medication is gingival enlargement.
Oh, wow.
And so his gums were enlarged to the point where it was affecting his ability to eat.
Oh, no.
And it was also causing him some self-esteem issues.
Oh.
And so the dentist decided to do a gingivectomy
Okay.
using external bevel incisions.
Okay.
And the results were really good.
So they were able to restore his gums to their natural shape and contour
They were.
and regain his self-confidence.
Yeah. And he was able to eat normally again.
It sounds like they were able to really address the underlying cause
Yes, they were.
and really improve his quality of life.
Absolutely.
It's amazing how much something like this can affect your life.
It is.
And I think this deep dive has really opened my eyes to the complexity of gingival enlargement.
Me too.
I think a lot of people just don't know much about it.
They don't.
And it's really important to seek professional help if you're experiencing any changes in your gums.
It is. Early intervention is key.
So I just have one final thought for our listeners.
Okay.
Knowing how much gingival enlargement can impact your daily life, what steps are you going to take to maintain healthy gums and a confident smile?
That's a good question.
Until next time, keep exploring.
Keep exploring.